So you've seen this slide before. When Pat put it up, I thought we were thinking the same thing. So it is November. It is National Family Caregiver Month. And the same quote came to my mind when I was thinking about this task. So there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, and those who will be caregivers. Okay? Those 3 probably include many of you. Okay? The 4th one, though, those who will need a caregiver, probably includes all of us. Okay? If you have a formula that you can share with us that guarantees that you will not need a caregiver, raise your hand. Okay? No such thing, and that is why I love this. Now, in the last few years, we have really moved into prevention, right? Heart prevention, memory prevention. We want to prevent everything. I say, okay, let's work on prevention for caregiving. So, for all of you, thank you for being here today. This world is better because you are a caregiver, because you have been a caregiver, or because you're preparing to be a caregiver. This world will be an even better place if we all prepare for our own caregiving. Okay? If we do our part to make the caregiving role of the person that will care for us a little easier. That is in our hands. We have the power to do that. Just like we have the power to make our heart healthier. Okay? I have a caregiver who every time I see him, he says, eat better, exercise more. Okay? You have that in your power. So I say to you today, it is in our power to make a difference in our own caregiving. So for most of us right now, we're probably sitting pretty. We don't have memory problems ourselves. We are on this road that maybe is not paved, but it's still very nice. There's a little bump here and there, but we still have flowers around. We have some shade. We're doing good. This is a good day for us to start thinking about caregiving for us, as well as our caregiving role. So I always say we hope for the best, but we plan for the worst. We do that for our house, right? We buy insurance, and we buy insurance for earthquake, for fire, for everything that we can think might be a risk, right? But do we do that for ourselves? Do we insure ourselves? Very often, we do not. Okay? We do not prepare for a diagnosis of something like Alzheimer's disease. And I tell you that if you start thinking long-term care insurance, when you are in my office talking to me, it is too late. No one is going to sell you long-term care insurance if the diagnosis or even a visit to the Alzheimer's Disease Center is in your medical record. It is too late. So we need to start now. What do I do to assess when someone needs help, when someone needs assisted living? And assisted living can be in a facility or at home. I look at 3 different components. So I'm going to start with health, because I normally start there. I'm a medical social worker. So I look at cognitive health and general health, and that's where I'll start. It is critical to assess health and ability as we age. Why? Because normal aging changes, acute illness, cognitive decline, worsening chronic illnesses, hospitalizations can contribute to a decline in ability to perform tasks necessarily to live independently. It is almost a given with age. So let's look at the cognitive spectrum. So this is normal right here. This is mild cognitive impairment, a new diagnosis. Okay, only in the last 10 years have we been talking about mild cognitive impairment and then dementia. So if we have someone who is 90 or even 65 with normal cognition, or even 25 normal cognition, as we age, let's say someone who's 70, as we age, the probability of having mild cognitive impairment increases. Once we have mild cognitive impairment, the likelihood of us going to a dementia diagnosis also increases. Okay? If we look at health, the same thing. So right now we're probably all very healthy, but as we age, the likelihood of having some health problems or having severe health problems increases. If we have normal cognition and if we have good health, even if we're 90, chances are we're still independent. If we have normal cognition and mild health problems, chances are we're starting to need help. That it is my job to see whether or not someone is needing help here. If someone has normal cognition and severe health problems and is 80 or 90, we look at, are they needing help? When someone changes from normal cognition to mild cognitive impairment and they have good health, they might very likely still be very independent. If they have mild cognitive impairment and some health problems, they're probably changing to needing some help. If they have mild cognitive impairment and severe health problems, likelihood is that they're needing help. When someone has a diagnosis of dementia, even if they have good health, they're needing some help. Okay? The diagnosis of dementia alone means that the person is having enough cognitive problems with memory or language or visual spatial ability or executive function that it's interfering with their activities of daily life. It means that somehow they can't put it all together to function independently. They're needing help. So even if they have good health, they're needing some help. Okay? And early in the dementia process, it might be that a little bit of help and coaching is enough, but they're needing some help. If they have a dementia diagnosis and mild problems, health problems, likelihood is they're needing help. And maybe they're even needing a lot more help. If they have a dementia diagnosis and severe health problems, I get very concerned because they probably are needing a lot more help. Okay? A lot more than someone here. How do I assess functional ability? You know, it should be easy to say whether someone can do something or not, but it's not that easy. This is a caregiver interview that we do, and what do we as caregivers often do? We do a lot, but really admit to very little. Okay? Very often the doctor will come in and say, can you help me with this caregiver? Because I think that the patient must be having more problems than what the caregiver is endorsing. Okay? I go in, and it really takes a lot of time to get the caregiver to admit to what they are doing. Because we do it, we don't think about it, and often we don't want to even think about it. We don't want to admit to ourselves all that we're doing. So assessing activities of daily living. What are the components? So dressing, grooming, bathing, toileting, and feeding. How do I assess each one of those components? Through a caregiver interview. So if someone's able to dress, undress, and select appropriate clothing, they're independent. What do we mean by appropriate clothing? Okay, that means appropriate for the weather, not soiled, okay? And then what is require assistance? That's someone who needs assistance in getting dressed or selecting the appropriate clothing, okay? Independent would be someone who's unable to do those, unable to select their clothes or unable to dress. The other two variables that are important to think about is this because of a physical illness? Are they able to physically, do they have the strength, do they have the motor ability to be able to put their clothes on? Or is this a change from 10 years ago? Okay. How many women in this room have always selected the clothes for their husbands? Very often. Very often, you know, we have always done something like select the clothes for our spouses. So we want to know, is it a change? Is it a change from 10 years ago? So when I look at impairment of activities of daily living, if they are in dressing, grooming, or feeding, I know that those activities of daily living are easier for someone to help with and are easier for the recipient to receive the help in. When I look at something like bathing and toileting, that is harder for us to provide, and it's harder for a recipient to receive. It's a much more intimate help, okay? And I have many caregivers that often fear, what will I do when she needs help in going to the restroom? Will I be able to do it? We don't know that every patient with Alzheimer's disease will need help with this, but you know, many do, and you know, it is very hard. It does become much more difficult. So for all of us that are not impaired today, this is something we might want to think about and coach our caregivers for the future in terms of what we want them to do. Do we want our sons or daughters or a spouse to help us with this activity? Or do we want them to hire someone to help with that activity? Okay, that's a decision we can make for ourselves so that our caregivers don't have to struggle in making that decision for us, and so that they don't feel guilty if they're unable to do it. So then if we move into assessing instrumental activities of daily living, these are activities like the ability to use the phone, shop, prepare food, do housekeeping, laundry, transportation, medication management, and financial management. Again, we assess it exactly the same way. So someone who's independent with medication takes medication in a correct dose and at correct times. Someone who requires assistance takes daily medications if it is prepared in advance and is separated by dose, and sometimes needs reminders and might miss a dose here and there. Someone who's dependent requires someone to dispense the medication for them, to organize the pill box for them, and if left to their own devices, will forget doses consistently. Again, we want to make sure that someone is able to open the pill box and that this is not because of a physical inability. And we want to know, is this a change? And I again divide this into two. So ability to use the phone, shop, prepare food, housekeeping, laundry are easier instrumental activities of daily living to help with and to receive help with. transportation, medication management, financial management, those are hard to receive help with and hard to help with. So how many of you have been trying to help your parents with the finances? Raise your hand. How many of you have found it difficult? Yeah. Who wants to give up their checkbook to their kids? Who wants to give up their car keys? You know, I very often talk to families who come in and say, the doctor reported him to DMV, that was 3 months ago, they're still driving, I know they're unsafe, what do I do? And I say, take those keys away. Oh, no, he will kill me. You know, they say, oh no, he's not gonna go down easy, he's gonna scream, he's gonna yell, you know, he's gonna, not wanna see me ever again, it's gonna affect my caregiving role, oh my God, my brother's gonna get involved. And I say, you have to take away the keys. You are the caregiver. There is no ifs or buts. You need to take those keys away. And if they just, they just can't do it, we try to get another family member who can. And if it can't, we need to call DMV and say, hurry it up. You need to get this done soon. Or we need to call the primary care and have them do it. If the patient gets mad with the primary care and fires them, well, we'll find another one. That is just very challenging. But how many of you have thought about, when do I want to give up my car keys? Yeah, right? Like, who wants to think about that? So what are we doing when we don't decide? We are deciding not to decide and leaving the responsibility to whom? Okay, are we not all here saying we are really stressed and overwhelmed and this is really hard? Right? But what are we doing to our caregiver by not deciding? Exactly the same thing. We're putting them in the same position that you are in now. Okay? This is what I did. Okay? I have the privilege of working with a lot of caregivers who give me a lot of advice. Okay. Sometimes I want it, sometimes I don't, but hey, it's free advice. Okay, so I talked to my daughter and I said, okay, this is a facility that I want you to check out first. Okay? And I said, and you have to do it because your dad will not. This is the area I want to be in, okay? And then I said, if you feel that I'm an unsafe driver, you need to take the keys away and not look back. If you need to have my car towed away, you do it. Because if I haven't given you my keys, it means that I'm not thinking logically already. I'm not aware that I have a problem. Okay? We cannot ask someone who has cognitive problems, many times dementia, to be logical. That is why they carry that diagnosis. They are impaired. And trying to force the issue is only making it more stressful for us. So then I proceeded to tell my daughter, in case you forget, I'm writing this little note for you. She knows where my documents are in my house. Both her and my sister know. So I said, it's right here. These are the notes you need to review. This will be there. If you forget this conversation, this note will remind you. Okay? I also told her, I never want you to help me with my toileting. If I ever need help with that, you hire someone, honey. You hire someone to do that for me, because I do not want you to do that for me. You can take my checkbook, you can give me my meds, but I do not want you to go there. Okay? That is something we all in this room can do. Okay, so now imagine caring for someone who has impairments and needs help with multiple difficult areas. So with bathing, toileting, transportation, medication management, and financial management. That's when this happens. Okay? One person's arguing, the other person's not listening. We go there all the time. Now you can see how very quickly, in a matter of 20 minutes, we went from normal cognition to assisted living to dependence. It is that quick. It is in a blink of an eye that we go from caregiver to care recipient. And I know none of us wanted to hear that today, right? But I have to tell you, I've been in our center only 22 years. Okay, sounds like a lot because it's in one place. But is 22 years a long time? No, it is not, right? It happens very quickly. Now, I have to tell you, one of the most difficult days at work was when I saw the daughter of one of my patients. Okay? And it's because I wasn't seeing her as a caregiver anymore. I was seeing her as a patient. Okay? I can tell you that in the last years, the number of caregivers that are now coming to see me for an evaluation of their own problems are more than I can count in my fingers. That hurts. That hurts. And that's when I start thinking about prevention. Because what I'm seeing is that their own kids are dealing with exactly the same thing. Okay? My caregivers did not prepare financially, legally, or emotionally for this. And it's a vicious cycle. Which brings me to the second area that I look at when assessing assistance in care. And it's this one, financing. So we all save for a rainy day, right? Who here saves for a rainy day? Okay, if you're not saving for a rainy day, raise your hand. Okay, a few people are not saving for a rainy day. Okay, do whatever you need to do. Cut off your coffee, take the bus, do whatever. But you need to start saving for a rainy day, okay? That's one thing that the generation that I work with, the 80-year-olds, 70-year-olds that are coming into our clinic, really did well. They really saved for a rainy day. I like to look at it as, building an umbrella for a rainy day to protect you. And I say, that umbrella has to be big and strong because sometimes the water comes down pretty hard. I often see families that say to me, I want to stay at home the rest of my life. I do not want my kids to place me. I do not want my husband to place me. And I even made them promise me that I'm never going to be placed. How many of you have heard that? A lot of people. And then I turn to them and I say, that is great. I would love to stay in my own home too. So I say, did you prepare financially for staying at home? And very often they're like, what? How much would it cost? And I said, you should tell me, because you should have looked at what are your monthly bills, what will be the level of care you want at home, and how much that will cost you. Right? If we have a wish of staying at home, we need to help our caregivers make that wish come true by being able to finance it. So you have to look at what your monthly expenses are plus care. Moving into an assisted care facility right now, the national average is $3,500 is what I see. And then in terms of moving into memory care, the average is very wide, from $1,500 to $7,000. I think in Sacramento, maybe you guys can confirm, I think it's more like $4,000 for memory care. Higher? Yeah. So, like, how much would it be?
We start at $5,600.
$5,600. Okay. So, you have to really look at what the numbers are. The other thing too is that a lot of people are confused about what Medicare pays for. A lot of people think that Medicare Part A or Part B will pay for care at home. But Medicare Part A is a hospital insurance, and it pays for hospitalizations. And skilled nursing facilities only if needed to meet your health goal. Most of the time it's after a surgery to recover from the surgery so that you can go back to your home. And Medicare Part D covers for doctor visits, lab tests, and home health. And only home health to meet your health goal. So, if you had a hip surgery or a knee replacement, you go home, they send a nurse a couple of times, a rehab person a couple of times, and that's it. That's all they will pay for. How can you pay for assisted living? The biggest part comes from here, savings. Then from long-term care insurance, property, life insurance, VA services for some people that qualify for VA, and for some people that qualify for Medi-Cal and in-home supportive services. So this is what I have seen in terms of what is needed to save for our retirement, anywhere from $500,000 to $1 million. And I know we have a legal financial advisor here. Does that sound right? Is that person here? Maybe that person's not here yet. But this is what I have seen. And then in terms of long-term care insurance, it varies widely. You need to make sure it covers home health if that's what you want. If you're really wanting to stay at home for a long time, some insurances have more hours in terms of home care than others. But we also have an expert in insurance here today that can help us with that. And then, I forgot to put the reverse mortgage word in there. But many people have done reverse mortgages, and many families have been happy with it. I do know a couple that have been unhappy with it, so I always say proceed with caution, but that is another pot of money that can be used. And then I have even seen life insurance used for paying for care. Again, I'm not an insurance person, so I'm not sure, but I think I have seen that done. And then Medi-Cal and in-home supportive services, this is based on an income. And for Medi-Cal, for nursing home care, legally there's a lot of issues there that you need to address beforehand. So I can't stress enough that addressing your legalities, including your finances, with an expert is well worth your money. I know a lot of people get scared when they see, an attorney's fees at something like $300 an hour, an accountant fee for $200 an hour. It kind of is scary, but at the end, it can really make a big difference for you. The other thing that I would say is that if you do prepare for your future, if you do have some savings, your insurance and everything else, you need to open up that umbrella early enough, okay? I often see people sitting on money or insurances and assets, and they don't want to use them, okay? They refuse to bring in help for a few hours. And a lot of the time it's just the fear of involving someone else, involving formal care. But you know what? When families do that, when they bring in respite as needed, maybe a couple times a week, and then increase it to a little bit more, and a little bit more as needed, your money goes a long ways. It really does make a difference because, one, your health as a caregiver is better. Two, you're not getting burned out and preventing probably unsafe things. So I say, open up that umbrella when it's just starting to sprinkle and just cover your head and open it a little bit at a time as the rain gets harder. It can be very, very hard to find someone to help you care for your loved one, but you will be much better for it. I was talking to a caregiver just yesterday, and he said, probably the best gift I've ever got was from a psychiatrist. So when his wife was first diagnosed, they were sent to a psychiatrist for medication management, and that psychiatrist really knew caregiving. I can tell by the way he interacted with this caregiver. He said to him, "Here's my card. Call me anytime, 24 hours a day." Who does that anymore, right? Then he said, "You do me a big favor, and you get someone to help you with your wife at least one day a week." And then he said, "That is your prescription. That is the medication I want for you." Now, this caregiver took that to heart, and he did it. That caregiver now comes 3 times a week, but he's been doing this for 7 years. And he still remembers very clearly that interaction. And he said to me, I said, "Well, very often I say that to people and they just don't listen." And he said, "You know what made the biggest difference for me?" He said, "This was another man telling me I could call him anytime, 24 hours a day." And he said, when he said that, I knew I was in it for, a long haul, and that this was going to be really hard. And he said, so I just listened to him and I did what he said. So I wish more people would do that. So that brings me to the last area that I look at when I'm assessing assisted living. So when I look at this area, I look at, what is the caregiving situation in terms of family members available? Now, we all like to think about when our grandparents took care of the little ones. How many of you here had grandparents who helped with your care? Yeah, wasn't it nice? And then we took care of the grandparents. And that was just kind of a given, right? You live close and, they help and you help, and it's a nice, large, extended family. We now find ourselves in a time when the old are outnumbering the young. And Patricia talked about the sandwich generation. And you would not believe how many caregivers I have who are dealing with their own parents, their in-laws, their kids, and a job. Now, in their heart, they want to be a caregiver. They want to provide the care. But many times, they're unable to. It's just too much. Now, if that caregiver had the ability to hire some help, it would make it easier. Because caregiving is not just about you actually being the person doing the care, but also supervising the care. Overseeing the care. That is a key role. And so if they had the ability to do that, they might be able to help some more. Very often we feel like it's our responsibility. We say, it's my wife and they would do it for me. She's my mom. I live closer than my sister, so I got it. But very often people say, it just happened. I did not sign up for it. We never talked about it. I never really thought I was the appropriate person to do it, but it happened. And then what? Okay. So how many of you here have thought about who will be your caregiver? Okay. How many of you have actually talked to that person? Yeah, right? Yeah. So we go back to the wish. We were wanting to live at home the rest of our lives, but we don't want to plan for it. We don't want to think about it. So the same thing happens with caregiving. We very often think about, okay, who will be my caregiver? And in our mind we say, Susie. Susie is the perfect person to take care of me. She's going to do a great job. I trust her. I know that I will be in good hands, right? But we've never talked to Susie about it. Okay, Susie has no clue. And Susie might even be thinking, it will never be me. I just know it. I know it's going to be my sister who's the favorite one. Or I know it will be my brother because she does whatever my brother says. Right? But it won't be me. Planning, it's so important. No one ever plans to get sick or disabled. Yet planning makes the most difference in an emergency. Please don't wait. Who here is under 21 years of age? Yeah, no one. That means we all should be planning. Okay? Planning means that you have your ducks in a row. All your papers, your paper copies, your legal documents, everything in one place. And that someone knows where that place is. Okay, how many of you have trust, durable power of attorneys? Okay, so a lot of hands didn't go up. But for those that did go up, does your attorney in fact know that they are your attorney in fact? Okay, not as many hands went up. That probably means that many of you went, did a trust, a dual power of attorney for health or finance. You named someone to be the person who's going to help you. Then you did not close the loop because you never informed them. Okay, it's a secret. When I ask families, I say, well, who's going to be your attorney in fact? They're like, well, I think it's going to be so-and-so or so-and-so. And then I say, have you talked to them about it? No, we haven't talked to the kids about it. We don't want any drama. Okay? And I say, what kind of drama do you expect? Well, they're going to say, why did you pick him and not me? They're going to say, what did you leave him and not leave me? And they are like, we don't want to deal with that. The attorney knows who it is. The attorney has a copy. And I said, well, is the attorney being paid to come in and intervene when something goes wrong? I said, no. Okay, then the attorney just has a copy. They won't do anything until they're paid to do something. So if you have that will, that trust in your hands, in your home somewhere, your attorney, in fact, needs to know. You have to bite the bullet and, talk to your kids and have that difficult conversation. It won't be as difficult now when you don't need them as it would be when it's a surprise. When you have a crisis or you actually need them to step in and they're saying, but I don't know where anything is, but I didn't even know I was the one. Well, they never told me. Okay? So they need to know all that you know. Let me tell you another story. So I have a caregiver who, it's a couple, right? Neither one of them had dementia. Okay, one of them dies suddenly because it can happen. We could be healthy today and all of a sudden next month be really ill. Okay, one of them passed away, the female passed away suddenly, and things happen. Well, a year later, he's still receiving checks of accounts he had no idea they had. That whole situation was so frustrating for him that he said, I need to do something about this because I do not want my kids to go through this. So he sat down and actually did a phenomenal job of organizing everything. He sat down at his computer, wrote down all his passwords, all his accounts, all his insurances, all his policy numbers, companies that he had those with, all his legal documents, all his tax returns, all his property information, and put them in one big box. Then he had both of his sons come over, and he said, I named you both because I did not know who to pick. And here it is. This is the box. Read it. If you have any questions, this is the time for you to ask them. Because I do not want you to be dealing with my death a year later because I did not do a good job of telling you what I had and where. So legal documents, because many of you did not raise your hands, okay, can be broadly divided into two groups, and we have legal people here for our panel, so they will do a much better job of explaining this than I. You know, they can be divided into two areas. One is documents that communicate the healthcare wishes of you or someone who no longer is able to make those healthcare decisions. And then the other documents are those that communicate your financial management wishes when you're no longer able to communicate those. Now, a lot of people opt to save some money and do these documents themselves, okay? And certainly that can be done. You know, you can fill out the forms and have them notarized and do it that way. And you do save some money. But I tell you, if you have a home and if you're getting income every month, and I wonder if our financial person is here. No, not yet. I think that if you have more than $250,000, it is well worth it for you to actually get expert advice, to pay for expert advice and get that done correctly. You know, it will save you a headache at the end. And it seems like a lot of money, but when the state goes to probate, you know, it really costs you a lot more. Okay, so more than 150,000. How many in this room have more than 150,000 with house, car, insurance, everything you have, everything you own? Probably everyone, right? So please, please take care of that. In my 20 years of experience, I think that the best way of giving care and receiving care is doing a combination of informal care and formal care. So informal care, as Patricia mentioned before, is care provided by a loved one, someone who's not paid for providing that care. And then formal care is someone that we hire, an agency or an individual. And I think that doing that combination is healthier for everyone, healthier for the patient and healthier for the caregiver. You know, I don't know of any person that wants their family to neglect their own health, be depressed and angry because they're caring for them. We don't want that for our loved ones. And often the idea of us having to do it all comes from us, not from the person we're caring. So that's why, you know, I try to tell my daughter many things, because I don't want her to have that guilt of, I have to do it all. She's my mom, I have to do it all. You really want someone to be empowered to do a good job of caring for you, and at the same time continue to thrive in their own life. It's, you know, I very often worry very much about caregivers when I see that they have stopped thriving. And what do I mean by that? I mean that caregivers can become so sad, depressed, isolated, sometimes even bitter, that I don't see them wanting to live. I see them living only because they need to care for this person. And I get very worried, because your mental health and your health are all at risk. And I also see many caregivers who run themselves to the ground. They don't go to the doctor, they don't go to the dentist, they don't go to their optometrist. Why? Because they're so busy taking care of their loved one. And I don't want my daughter to do that. Do you want your caregiver to do that? No, no one does. But unless you openly talk about it and tell them, then, you're leaving it up to them. And our guilt is so huge. So I always say, in looking at this umbrella, communication, which is not even in any of the boxes I talked about, is so key. But in order to have a good umbrella, you need to really do your planning, be aware, and open it up slowly as the disease progresses. Don't wait until you're in crisis. And without that little egg, golden egg, it's really, really hard. So for that person that said they're not saving, you need to get on it.